What are the specific tests for sleep hyperhidrosis? Have you ever woken up in the middle of the night, drenched in sweat, and wondered what was happening? If so, you might be experiencing sleep hyperhidrosis. This condition involves excessive sweating during sleep and can be linked to various underlying issues. To get to the bottom of it, specific tests are available to help diagnose this condition accurately. Let's break down what those tests are. First, the process begins with a thorough medical history and symptom review. A healthcare provider will ask about your sweating patterns. They will want to know when the sweating occurs, how often it happens, and how long you have been experiencing these symptoms. If you have been sweating excessively during sleep for 6 months or more, it is essential to share this information. Family history and any possible triggers are also important to discuss. This helps differentiate between primary hyperhidrosis, which typically does not occur at night, and secondary causes that might lead to night sweating. Next, a physical examination will be conducted. The doctor will check which areas of your body are affected by sweating. They will look for whether the sweating is localized to specific areas or if it is more widespread. Primary hyperhidrosis usually affects symmetrical areas like the palms and underarms, while night sweating may suggest a secondary cause. Sweat tests are another crucial step in the evaluation process. One common test is the Iodine-Starch Test, also known as Miner's test. In this non-invasive test, iodine is applied to the skin, followed by starch powder. Areas that sweat heavily will turn dark blue or black, helping to pinpoint where the sweating occurs and its severity. Another method is gravimetric measurement, which weighs absorbent materials placed on the skin to measure sweat production over time. This test is more commonly used for daytime hyperhidrosis but can still provide useful information. Laboratory tests may also be ordered. Blood and urine tests can help rule out other medical conditions that might cause secondary hyperhidrosis. Conditions such as infections, hormonal imbalances like hyperthyroidism, diabetes, or even malignancies can lead to night sweating. These tests are vital when sweating occurs during sleep, as primary hyperhidrosis typically does not cause this issue. Lastly, quality of life questionnaires can be used, although they are not diagnostic tests. Tools like the Hyperhidrosis Disease Severity Scale and the Dermatology Life Quality Index help assess how much the sweating impacts your daily life and sleep quality. This information can guide treatment decisions and track progress. In the context of sleep wellness, accurately diagnosing sleep hyperhidrosis is essential. Excessive night sweating can disrupt sleep quality and overall health. By using these specific tests, healthcare providers can identify the root cause and recommend targeted treatments. This may include addressing underlying medical issues, making lifestyle changes, or exploring therapies specifically for hyperhidrosis. Understanding these tests can help you take the first steps toward a more restful night's sleep.